Okay, so we can see that there are people filtering in. So we'll continue to let people join the webinar. We will get started just out of respect for time. And I'm going to pass it over to Kathy Belton to introduce herself and this evening's webinar. Kathy.
Thank you very much, Erin. And my name is Dr. Kathy Belton, and I'm the Associate Director at the Injury Prevention Center in the School of Public Health at the University of Alberta. And I'm very pleased to be your MC tonight and to bring you this webinar on behalf of the Alberta Concussion Alliance. And the Alberta Concussion Alliance is a partnership between the Sport Medicine Council of Alberta and several agencies, including the Injury Prevention Center, to work to bring evidence-based messaging and resources to Albertans as a whole when it comes to concussion prevention. Next slide. Before we start the webinar, I'd just like to acknowledge that we are gathered today at the traditional meeting place and home for many Indigenous peoples, including the Cree, Dene, Pikwani, Anishinaabe, Blackfoot, Stoney Nakoda, Nakota Sioux, Tsuut'ina, Siksika, Inuit, and Métis people, as identified in the Treaty 6, 7, and 8, and Métis regions 1, 2, 3, 4, 5, and 6 territories. Next slide. Your microphone, just a little housekeeping, your microphone will be muted and your camera will be disabled for the entire webinar. Live transcription is available for your convenience. Please click on the CC label at the bottom right of your screen. The webinar will be recorded and posted, I believe, on the Concussion Alliance website and the Injury Prevention website. If you have technical or connection issues, please put your questions in the chat. And the other thing is that there's going to be a Q&A at the end of the webinar. So, and if we have any extra leftover questions, we will record them, and Dr. Morasic will answer them, and we'll post the questions with the webinar at the end. Okay, thank you. Next slide. So I'd just like to introduce a friend and colleague of mine. Dr. Marty Morasic is a clinical neuropsychologist and a professor in the Department of Educational Psychology at the University of Alberta. He completed his PhD in the School in Clinical Child Psychology program. He has been an investigator in multiple CIHR-funded studies in Canada, investigating sport concussion and mild traumatic brain injury in children. He has consulted with the National Hockey League since 2004 and serves in an associate research role with the Canadian Football League since 2008. Dr. Morasic has published over 60 manuscripts and book chapters and presented nationally and internationally on the topic of sport concussion. He was the first Canadian honored as a fellow with the Sport Neuropsychology Society for outstanding contributions to the field of sport concussions. Dr. Morasic is a very proud husband and father of 2 amazing daughters. So thanks very much, and let's give a warm welcome to Marty.
All right, thank you for that introduction. Thank you very much, Kathy. Can you hear and see me okay? Just give me a thumbs up there. All right, and then I'm just going to move to the share screen mode. There we go. Just want to make sure that everything is working. Okay, Erin, can you give me a thumbs up if you can see that okay? All right,
Looks
wonderful.
Good, yeah.
All right, well, thanks very much, and good evening. Really good to be here. Thank you to the Alberta Concussion Alliance for the invitation to be here. Thanks for coming on a Monday night. I understand that it is National Lumberjack Day. So for those of you that are lumberjacks in the audience, a special welcome to you. And it's also National Pancake Day. So quite the celebrations that are going on today. So maybe we took you away from some of those celebrations, but it's good to have you. So I'm just going to go through a couple of slides here. And so I'm very privileged to speak on a topic that I've spent a lot of my time thinking about and researching, and very, very happy to have these opportunities to share this information with you as a public. And again, if there's any questions at the end, be glad to answer those. And so really have a few goals for this presentation. One of them is to understand a little bit of what is a concussion and the science behind concussions. I'm a professor at the university, so of course we've got to squeeze some of that in. Understanding evidence-based practices. There certainly has been a lot of information on concussions. Some of it has been a little confusing, and so that's why we're really glad to have this opportunity to share this information. And I think a very important topic that we've really seen emerge in the last number of years is just looking at mental health issues. Just by way of a bit of an introduction here, my background is I'm a neuropsychologist. So it is a specialization in the field of psychology. I think I have the best job in town where I get to work with people, all kinds of people, and then also with my students at the university. And the area of interest for me has really been in this very fascinating field of brain and behavior relationships. And so you can see here a few of the definitions that we work with. So I have a quiz for you. Keep your brains engaged or your minds involved. And so you can see there's a few questions about the important organ of focus for tonight, and that's our brains. And so just I'll give a few answers here, but the average human brain, how much does it weigh? Well, the average brain weighs around 3 pounds, yet it takes about 25% of our cardiac output. So I guess you could say it's a pretty high maintenance organ, and yet at the same time, it has a lot of demands because the next one is the brain contains about 150 billion neurons and 10 times as many trillion support cells. 150 billion, just to give you a context, if you were to stack loonies on top of each other, it would take you to the moon and back 1.5 times. So that's clearly a lot of stuff going on in your head. Brain impulses, the way that the brain communicates from cell to cell, travels at over 250 miles an hour. I guess I should convert that to kilometers an hour, but about 370 kilometers an hour. So again, that's when we think. Obviously, it's pretty amazing to think of how quickly thoughts are going on in our head. And speaking of thoughts in our head, about 70,000 thoughts go on in our head. A lot of them are just automatic thoughts, things that we're not very conscious of, but that again tells us the immensity of what's happening in our brains. And based on the electrical currents of the brain, it actually generates electricity enough for 25 watts, which these days is a pretty decent LED light. So again, lots happening in your brain, which is why it's a good thing to protect it, as we'll talk about today. So I want you to take you back a little while ago to 2010. Hopefully many of you remember that, especially if you're proud Canadians like me. And you may remember Sidney Crosby and his golden goal. And that was a pretty momentous occasion. He was Canada's up and coming superstars at the time. And then a year and a half later, he was in the Winter Classic. And so I'm just going to play it here. And you'll see that you'll hear the audio, and then I'll come back in and talk a little bit more about it.
Second period comes to an end. Sidney Crosby is doubled over, heading to the bench in some pain, clearly, as the second period comes to an end. A period that was great for the Washington Capitals. Or if ever there is a team praying for a rainout, this is it for the Caps. Here's Crosby. Just getting into position. Did he turn, get hit? Oh, yeah. Steckel got it. Wow. You talk about blindside. Didn't look like Steckel was really looking at him, but there's your description of a blindside. Let's watch 39. He's looking for the puck. He's trying to go up.
All right. So again, a pretty devastating hit. I personally think it was a dirty hit, but that's besides the point. But really, that concussion seemed to really bring about a lot of public awareness. And so in the weeks and months and years that followed, it started to make the headlines. And concussions is the only injury that I know of where they actually made a movie about it. Now, I don't think it was a great movie, that's my opinion, but still it talks about the immensity of this issue. And so there was lawsuits, there was all kinds of controversies about concussions. And so certainly it's a topic that has really risen to be an important one, but that's brought a lot of media headlines. And so if we were to type in Google, like I did this morning, in less than a second, you're going to get 84 million hits. It's pretty amazing to think about the immensity of the pieces of information out there. And a lot of that information can be helpful, but there's also a lot of wrong information, not evidence-based information. And so it can be very confusing. The landscape can be very challenging to understand. And so that's why we want to talk about the topic tonight. So we're going to just show you a little bit. And so our formal definition of a concussion, and I don't know how many people in the audience has either had a concussion or know somebody that's had a concussion. Our scientific definition is you can see there. And I'm going to just show a bit of a video here that talks and shows a few important points. So you can see here.
Concussion is a type of traumatic brain injury, or TBI, caused by a bump, blow, or jolt to the head, or by a hit to the body that causes your head and brain to move rapidly back and forth. This sudden movement can literally cause the brain to bounce around or twist in the skull, stretching and damaging the brain cells and creating chemical change.
Okay, sorry about that. I think the important point when we think of the definition that they were talking about there is your brain is actually quite jello-like. It's not a hard substance, and yet your skull is. And so whenever we see a rapid movement of the brain inside the skull, we get some stretching associated with the axons of the brain, and that can be very problematic. You want to think of a piece of licorice, and if you were to pull at either end and start to stretch it, at first it would just stretch, and then you would start to see little tears in it, and then it would eventually break. And so anytime we see a sudden movement of the head, that's where we get concerned about a concussion. And I just want to point out a few important details. One of them is that it doesn't necessarily have to be a direct blow to the head. Sometimes we see concussion happen after significant movement of the neck, as in a whiplash injury. Now, from a brain physiology perspective, we see this rapid onset of short-lived impairment of neurological functioning. We're going to talk about what that looks like in just a minute. And then we see that it's a functional disturbance. And that's important because a lot of times people wonder, well, why shouldn't I go to the emergency and get a CT or an MRI? And again, we rarely would see any evidence on a structural image like a CT or an MRI. So it's a functional disturbance, and that's why we'll talk about the tools that we use to measure outcomes of a concussion are very functionally based, things like memory, balance, and that kind of thing. The other important thing that it's important to note is that concussion doesn't necessarily involve a loss of consciousness. In the world of sports, where I spend a lot of my time, there used to be a lot of myths that unless you were knocked out, you didn't have a concussion. And of course, we know that to not be the case. So here's a little bit about the science and explanation of what's happening in the brain if you've suffered a blow to the head. And so you can see that as we talked about, this injury causes diffuse axonal injury, or a stretching of the axons, which are the wires in the brain connecting brain cells. And this causes a chemical change. And obviously for a brain to work as sophisticated as it needs to be, it's very dependent on a very defined set of neurochemistry. And so anytime there's trauma introduced, there's a change in that chemistry, and you can see some of that involves a massive release of potassium ions. So the brain is not happy when there's this neurochemical change. And you've probably heard the term homeostasis, but that's used to refer to a scenario when a body system wants to return to its resting state, its normal functioning. After a concussion, the brain needs to get back to this resting state, but there's been a change in chemistry. Well, that takes an awful lot of glycogen or glucose, a lot of energy. And if you've ever, played sports or gone for a walk and you're hungry, or you've gone to a class, you just know that if you don't have enough energy, there's a deficit, and that can be really problematic for a lot of things. And that's what it is with brain injuries, is that we see this demand, initial significant increase. The brain loves glucose, it loves sugar. In fact, a high percentage of our blood goes to the brain, about 20–25%, and it really loves to consume sugar. Obviously, certain sugars are much better than other sugars, but we also have this corresponding lower rate of blood flow, and so it creates this mismatch where you don't have enough energy, and that's often some of the reasons why you experience these persisting symptoms, is because your brain is trying to return to this normal state. As I mentioned earlier, it's a really a non-structural image. You can see here a common imaging is an MRI or a CT scan. In rare cases where there is concern about potential bleed in the brain, they will put a person through a scanner, but it is radiation, and especially with kids in Canada, we've developed a rule that it really limits how much exposure we want kids to have to CT scans. And so again, it really reminds us that imaging is not a common thing after a concussion. All right, so if somebody's had a concussion before, there's a few things that if we're talking to that person, we want to know. And those things are about their history and also their history of concussions. And so you can see here that there's a few things that are what we call modifiers. And that simply means people who have some of these modifiers are more likely to experience adverse outcomes after a concussion. And so you can see some of those have to do with the injury itself. So if there's prolonged loss of consciousness, or if there's a prolonged amnesia, that tends to go with a longer recovery time. And that's why an important part of or understanding a person's concussion is an interview. But we also see the timing of concussions, so successive concussions in close proximity, like in the same month or the same season, or a history of a few other things that we're going to talk about. So these are modifiers. These are things that we want to know about. And any time that you're involved working with athletes, these are important things to know, because this can explain why they have persisting symptoms. Okay, common symptoms. Those of you who have had concussions probably recognize some of these. So you can see some of these are very physical in nature, things like headaches and dizziness, nausea, and some of them are behavioral, so mood changes, sleep disturbances, and cognitive in nature. So again, more problems with memory, more problems with concentration. One thing that we do look for in our athletes is a vacant stare. If you have any children who are in junior high school, a vacant stare may be a common thing in your household, but we're talking about after an injury. There's certainly a unique where a person is really not processing information. Not your typical adolescent vacant stare when you're trying to ask them to do something for you. I have 2 kids, they're awesome now, but teenage kids, hey? All right, so there's a few things that we do want to pay attention to, and you can see those that are highlighted here. And that's when we have confusion, irritability, or disorientation. Those are usually markers that there's probably been a little bit more trauma and a more likely recovery time that could take a little bit longer. Mood issues, as we'll talk about in just a few minutes, are really important to manage. So one of the questions I get quite often is, why are there so many differences after a concussion? Some people seem to recover within a few days. Other people, it seems to take weeks, months, and even sometimes they report persisting symptoms in the years. And so it's quite an interesting thing of why there are these differences. And so you can see here, it's kind of like this view of the brain, and there's different opinions. But what we'll talk about here is that outcomes from brain injuries are extremely variable. It's very different than a broken arm or broken leg, where we kind of know how to predict these things. Much more difficult to do that after brain injury. What's important too is that it overlaps. The symptoms that we see often overlap with other conditions. And that's why when an injury is complex and people are not getting better after they've had a head injury, we really want to look and understand what the clinical picture is like. So you can see here, if somebody's ever had a whiplash or a neck injury, you tend to have quite a bit of neck pain and dizziness, but there's also usually some visual disturbances. Some of my patients talk about that when they're looking around the room, that it really gives them a floating sensation. They actually find it hard to describe when you have this visual disturbance. It's kind of like if you've ever been at a stoplight and you look down and then the light turns green and you didn't notice it, and the car beside you starts moving and it feels like you're moving backwards. It's kind of like that odd visual disturbance. Sleep deprivation, again, if people are not sleeping well, comes with a whole host of difficulties, some of which overlap with concussions. And after a concussion, people also have some problems with sleep. So again, some of the things that we want to make sure we're paying attention to. And then mood, right? People who have mood disorders, including anxiety, we can see that there's a lot of cognitive symptoms, and those often overlap with a concussion. So again, a concussion can be complex because there's lots of other things that can overlap. And because it's not a structural injury, we're relying on people's subjective reports, and sometimes that can complicate things. However, we're really, I think there's been some real good steps taken in the research that we're doing, because we're noticing that there are subtypes. So it's not like everybody has every symptom imaginable. We tend to see that there's groups of people that present, especially 2 to 4 weeks after a concussion. Some of the subtypes have more of a cognitive look to them, so they really struggle with their memory and their concentration. Some people, it's more the balance and the dizziness issues. That's where they're struggling. And we have some groups that it's sleep. They're not sleeping very well. Some people, for them, the headaches are the real problem. And you can see other groups there. Ocular motor is, again, just that balance and head movements. You move your head back and forth. We have this incredible capacity to move our head one way and move our eyes another way to track things. And if you have a head or neck injury, that reflex can be interrupted. And then we have people that present with mood. So I just want to talk a little bit about some of the cognitive difficulties and why this is important. Most people who experience a concussion notice some difficulties with their cognitive functioning. It could be because of headaches, but sometimes it's because their brain is just not working like it should. And so here's, you can see some of the main issues that people will report. Their attention's off, a little more distracted. The reaction time seems slow, which is important in sports. Just their ability to process things quickly. So when they're reading, they don't seem to be picking it up as well. Just these general memory, organization of thoughts, those kind of things. And one thing that we do want to be careful of is we have something that's called the good old days bias. And so we've done some research in this area where we asked people who have had concussions to describe their symptoms. And then we asked them, what were you like before you had this concussion? And what we tend to see is people tend to underreport the number of symptoms that they had before and tend to believe that most of what they're experiencing they've never experienced before. Now, sometimes there is this change in their functioning, but we tend to see that some people tend to forget about some of the difficulties that they may be having. And obviously, from a clinical perspective, we want to know what's changed and what hasn't. So again, if somebody's distressed, they're anxious, they're worried, that's where we tend to see this over-report of symptoms. In our group that has mood issues, again, this is where we really want to make sure that we're treating the person, treating their emotions, treating their moods. And this can be a little complex if you have younger athletes in their teen years where there's a lot of changes going on, but mood can be a really significant variable for people. And if your mood is off, as you know, it can really affect your ability to connect with other people, your ability to feel normal. And so you can see some of the descriptors of when people have experienced a concussion, how they feel more emotional, or they feel overwhelmed, or their ability to react appropriately is clouded, and the feeling of hopelessness, discouragement. And so in some of the studies, we see in up to 50% of patients deal with emotional mood issues. So I want to talk about anxiety because this is an important concept. You often hear people talk about anxiety and that I'm stressed or I'm anxious, but here's our formal definition, and that's that it's characterized by a future-oriented emotion. And that's pretty important because when you actually start to talk to somebody about their symptoms, if you hear in their characterization that they're worried about things going on in their future, that they're not going to be able to control, that gives us an indication that anxiety may be playing more of a role than they're aware of themselves. And so that becomes a problem and can really affect people wanting to go back to school, go back to work, go back to sports when they develop these avoidance or worry behaviors. And so when people are not managing them well, when that anxiety is you're now starting to change your behavior and you're not doing things because you're worried, that's a problem. And we want to address that. And so this restriction in behavior really can impair your exposure, where people are so worried about their symptoms that they don't do what they normally do. And that can turn into a cycle. And here's a little bit of that anxiety cycle. And so, for example, if you have an anxious thought, and one of the examples could be that you go to the shopping mall and you forget where you parked. You come out and you have no idea where you went or where you parked. And that's a stressful situation. It's like, where did I park? Now, nowadays, a lot of cars have the alarms, which is very helpful. But if you don't, then you can be very worried. And then it leads to this question in your mind that something's very wrong. And then it can lead to these debilitating thoughts or behaviors where you're going, oh my goodness, if I can't even find my car, I'm not going to do very well with other things. Now, we want to look at base rates, which is the average adult who's 35 or older will tell you that they've forgotten where they've parked at some point in the last year. However, if you've had a head injury, and especially if there's a clinical, some clinical anxiety going on, that's going to really stick in your mind as problematic. And then it can bring in this anxiety cycle and bring about a lot of worry about your symptoms, where you restrict your behaviors, and that can be a problem. So what is our solutions? Well, here's the return to play guidelines. And especially for sports and for athletes, we really encourage people. We've developed these out of a lot of science that's gone on in the last few years. And I've been very blessed to be a part of some large scale studies where we've looked to see, if you follow these steps, is this going to help you? Are these steps, a good thing for your recovery? And the research is pretty clear that if you follow these steps and you stay reasonably active, you're going to do much better than you would if you just do nothing. So again, we used to know one of the first steps that I think is really important that some of you may have heard of before, which is going to a dark room. And maybe you've gone to see your physician, or maybe you heard them tell you, oh yeah, just if your brain is symptomatic, if you've had a concussion, go to a quiet place and don't come out until you feel better. We've actually wanted to debunk that as a myth, because we found that when people isolate themselves for too long, it actually causes more symptoms, especially anxiety. And of course, we've just come through a pandemic where we've had to do a lot of isolation, and the mental health that's created is pretty concerning. That's another topic. The point is that when a person has a concussion, or if your son or daughter has a concussion, we do want you to limit your activities, but we don't want you to isolate yourself. And by limiting, it means is that the things you normally do, so that includes being on your phone, being on the computer, playing games, all the things that especially younger adolescents are more prone to do, those things are okay, but we want to limit how much you do them. And especially paying attention if those activities worsen your symptoms. Because if they are, then we do want you to rest. We do want you to take it easy. We don't want you to continue on. So that's an important change from what we used to say before, which is go to the dark room. Evidence has just shown that's actually not a good thing. So symptom limited activity, and then as your brain starts to improve, as you start to feel better, the next step that we want you to do is we actually want you to engage in what we call light aerobic activity. Now, by light, I mean where you're limiting your heart rate. We don't want people to get on the bike and start cranking it up. Athletes love to get back to their normal activities. Again, where light aerobic activity is really limiting the amount of time and how much intensity you go to. So that's really important, is to really limit how much activity you do. But the important point here is also that it's not a harmful thing to do those activities. So go for a longer walk, 25 minutes, 30 minutes. increase the amount of time that you're doing for your other activities. And then step 3, the next step, is where you want to increase and work on more specific activities. So again, going for a longer walk, skating, those type of things that may increase your activity level, but are not increasing the blood pressure, not increasing your heart rate too much. So 3 steps there. Hopefully that's making sense. And then we get to step 4. And in the world of athletes, that's returning to your team environment. That's returning to doing drill activities. We want you to wear that yellow or red jersey. That's really important in terms of making sure that people don't sustain another blow to the head. You can increase exertional activity, but again, the key thing is really monitoring your symptoms, making sure those activities aren't spiking. This is where people can start to return back to work or school for regular activities, but we also want to make sure that you're leaving more time for rest because you haven't quite recovered yet. And so making sure that you're getting the rest you need is really important. Step 5 is going back to your regular work activities. That's where if you're playing sports, you go back to your contact training. This is a regular practice. And it's really at this point that if you want to get back to sports, you should see a physician to be cleared. Or if you're going back to work full time, you want that final clearance. That's really important before you go to the final step, which is normal play or work activities. Okay, so hopefully that helps in terms of prescribing what to do if you've had a concussion. So knowing that there's a step-by-step process. Now, a couple things that we want to talk about here about recovery, because for some people, recovery is complex. In most adults and most individuals, we see complete recovery within about 3 months. We do see some short-term cognitive and mood symptoms. By 1 month, most people have resumed their normal activities. So that's the good news, is that people get better from these things. Recovery are generally quicker for athletes for a lot of reasons. Some of them have to do with just being more physically fit, being more likely to get back to physical activity. So we do see that effect that people who have sports-related concussions tend to recover more quickly. Also age. So under the age of 18, it does take longer to recover just for different reasons. That's not to say that some people can't recover fairly quickly, but we tend to see adults recover slightly quicker than younger. The other thing that's really important is some people like to tough it out. Some people think that, okay, I'm just going to take a few Advil and then I'll be fine. We've seen some studies in the last few years that have shown that if you see a family physician sooner, or you go to the doctor sooner, it tends to speed up your recovery, probably for a lot of reasons. Maybe you're less anxious after talking to a doctor, maybe they give you some good advice, or maybe they just treat that condition. So actually seeing somebody early is a really good and important thing. A couple things we want to pay attention to though, and that's people who have risk factors, especially those with migraine, headaches, or cognitive difficulties. They can take longer to recover. We also find that getting people the right education is really important. And a colleague of mine spent a lot of research looking at how informative information from a mental health professional, not Google, is very helpful. And there's some links here that we want to show you through the Alberta Concussion Alliance, through the Brain Care Center. Really important to get the right information. Don't Google things. Because if you do, most people kind of know that if you Google things, you're going to get the most catastrophic, worst case outcome. And that's not a good thing. We don't want people worrying. And most people who Google things tend to be a little worried to begin with in case of dealing with injuries. Again, we do see that if you're involved in a medical legal practice, that seems to lengthen the time. There's a lot of issues there. I do medical legal work, and I certainly appreciate there can be some complexities there, but that does slow things down. One thing we do want to make note of is you may have heard of the 15% rule. And the 15% rule is 15% of people in one study had persisting symptoms beyond 5 years. Now, that's a study that often has been cited by people, and yet it's based entirely on subjective symptom report. And that's a bit of a problem because sometimes people are experiencing things, and as I showed you earlier, maybe it's because of other conditions and not your concussion. So this whole 15% of people have these long-term, issues. We have to be careful of knowing where that information came from. And so, like I say, it's really important to make sure that you have the right information that's helpful to you. And so you can see that there's certainly some good information that's there. Also want to add a little bit of a caution here. There's a lot of things that you can buy, a lot of things that are advertised, a lot of things you can spend your money on, and some things that don't necessarily have a lot of good outcome. I've seen a lot of advertisements for supplements of various kinds. What we do know is helpful, and it has gone through scientific scrutiny, is making sure you're hydrated. That's never a bad thing. Omega-369, so the fish oils are really good, and melatonin for sleep issues. We actually have studies that suggest that about 50 to 60% of people benefit from taking melatonin in the days after their concussion. Sleep, again, is really, really important. There's a lot of different professions out there, and right now we just don't see a lot of evidence for prolonged vision therapy. So those can be very expensive treatments, and yet we don't see a lot of evidence for that. And again, the other caution is that there's going to be some reports that if you come and do this certain protocol or come to this clinic, but we tend to find they can be very costly and exhaustive. And we want to make sure that if you go with the evidence, like I'm showing you here today, that's the best method for improving your symptoms. Here's another example of that. So Dr. Catherine Schneider down in Calgary, she's done a lot of great work with people that were not getting better. These were young athletes that were having problems with dizziness, with just not feeling well. And so what they did is they took half the group and they took them through prescribed activities. The other group was just left to slowly improve over time. So they compared a group that went through prescribed activities and those that didn't. And we saw that there was a significant benefit. You can see there the recovery curve there is you were much more likely, if you go through and see somebody, to do specific targeted activities than if you did nothing at all. So it's important, reminder that there's more things that you can do, and that's where seeing a physio or an occupational therapist can be very helpful. Again, we want to talk about, as I just mentioned, the importance of good information. The other thing that I want to mention, as I discussed before, mood. As a psychologist, I see this in a fair number of my patients, especially those that are not getting well. They have a lot of anxiety or their mood is just poor. And that's no fun. It's no fun to feel poorly. It's no fun to feel anxious. It can be debilitating. People who are struggling with mental health, it can be a very isolating experience. And again, I think we're doing some really good things these days to really talk about how mood, how mental health can be addressed. This is an important one because if you see that somebody is burdened or weighted by their mood or by their anxiety, that can become one of the main sources of persisting symptoms. And so again, you can see here cognitive behavior therapy as a type of therapy that's really designed to target thoughts when people are struggling with anxiety or with their mood. And so again, we can certainly appreciate that somebody may not be feeling well, they're not getting better. And so what happens? Well, because they're not feeling well, they tend to restrict their behavior, and restricting your activities in most cases is a bad idea, and it's not going to help you get better. But because you're anxious or because you're not feeling well, that can be the thing to do. And so that's why when you see somebody who seems to be dealing with some of those mood issues early on, especially in our young adolescents, we want to make sure they're getting the right treatment. And that's a combination of seeing a physician or seeing a psychologist in order to help with that. The last point that I'd like to make that I think is a really important one when it comes to the topic of concussions. I've had the opportunity to research, to be involved in concussion research for over 25 years now. And it's been very interesting. And so there was this massive spotlight that was put on the topic of concussions. And you saw Sidney Crosby's concussion and how that seemed to be a really marked event. And people seem to be much more aware of concussions after that. So that's really led to, I think, some very good things that we talked about today. How do you treat a concussion and so on? However, that's kind of focused on the bad stuff, on the things that are not helpful to you. What I like about the field and in the neurosciences especially is that we've learned that the focus on concussions has also helped us learn about focusing on brain health. There's a really great quote from Nick Lewis, who's a former CFL player, and that was his perspective exactly as he said, I'm not so worried about concussions, I'm worried about brain health. And so we don't want to just focus on the negative, we want to focus on the things that can accelerate your brain performance. How do you optimize your cognitive functioning? How do you take your brain and turn it? This is one of my favorite vehicles, my dream vehicle, let's say, is a Shelby Cobra that, well, maybe one day I'll win the lottery or something like that. But the point is that we want to maximize our brain functioning. And so there's some really interesting research right now that talks about how do we do that. Things like improving your mental focus, your ability to manage distraction. So there's things called mindfulness activities, and maybe you've heard of them. Mindfulness, meditation, prayer, those type of things that really help the brain or really designed to have the brain focus on things. In fact, I'll tell you one thing is that there's something called the 17-minute test. And that is if a person is able to focus on what we call interoception. So that's they're very focused on their thoughts going through their mind and in their body. If they're able to do that for 17 minutes, we actually have evidence of long-term changes in the brain based on fMRI scans and PET scans and all those kind of things. I think that's pretty amazing how 17 minutes of a very cognitive interoceptive process can actually improve and we can see evidence of that. Another thing that I think is very cool is gratitude practices. Well, what is a gratitude practice? Most people think gratitude practice is when you take out a pen and a piece of paper and you write down, well, I'm thankful for my mom and I'm thankful for my dad and I'm thankful for the moon and the stars and all that kind of stuff. It's a little more complex than that. It's really focusing on the narrative of thankfulness. And there's some excellent podcasts by Andrew Huberman that talk about these practices. The reason why I bring that up is that we actually have some pretty strong evidence that gratitude practices, maybe 3 to 5 minutes a day, people who undergo and undertake these practices report a few things, and they're all good. One of them is they report more positive interactions with people. They also feel a little happier, and they also tend to be a little more relaxed. Pretty powerful how gratitude and specifics around that can actually be a positive, beneficial thing. You have these circuits in your brain that are designed to enhance social interactions, and I think that's pretty good. Last thing that I'll say is sleep. We just know the importance of sleep. I've probably been not a good personal example of sleep because I have a busy life, and yet we realize how important sleep is. Bit of trivia here, but 150 years ago, the average adult would sleep between 9.5 and 10 hours a day. Think about how much the average adult, think about how much you sleep a day. And I bet you it's not 9.5, 10 hours. So it's kind of interesting how we've evolved in terms of being busier, but we got to take care of our sleep. So I had a couple of case studies, but I think I'm just going to go through those because it's much more important for me that we answer any questions. So I would just want to thank you for the opportunity to present. Hopefully this has been helpful for you. If you do have any questions, feel free to put them in the chat. And I'm just going to shut my my screen. It's going to stop sharing. And then I'm going to just open it up to questions. So again, if anybody has some questions, please feel free to put them in this chat function. I think Erin is going to jump on here and she's going to just, we're going to have a bit of a discussion about those. So Erin, I'll turn it back over to you.
Thank you, Dr. Mrazek, for your presentation. That was amazing. I was even taking some notes and found many points very interesting, so I appreciate that. So yes, we are at the question part of the webinar. So if you'd like to ask a question, please put that in the Q&A function as opposed to the chat. And if you see somebody's question and you're like, that's the same thing I have, you can upvote questions as well. So I see we have a couple coming in, so I will read them out here. Okay, we have a question. Any research or opinions on CBD oil?
Sure, go right to the marijuana question. All right, that's yeah, we're talking about wading into controversy. So I'm not an expert in this area, but what I will say is that we certainly have seen some positive benefits from CBD treatment, especially with respect to pain, and especially for people that have persisting headaches, persisting symptoms that way. So we do have some, we don't have a ton of evidence right now. That's why we need to do more research in the area, but it's not one of those things we can easily discount. Obviously, you know, we want to be very careful with THC. So CBD oil that has a THC content to it is problematic. That can cause other issues, but there seems to be some pretty good evidence for sleep, for pain, and for anxiety. So again, we would want you to obviously consult with a specialist on that, but there is some good research there that I think is going to continue to be done.
Great, thank you. What do you feel about baseline for athletes?
So my personal opinion is I think it's a very good idea. I think that it's important because in order for us to understand what's changed, how do you know unless you've done a baseline evaluation? I know that they can be a little time consuming, but I also feel that they're very important in terms of if somebody has a concussion, you can actually measure how things are different afterwards. So I'm a big believer that baseline testing is good. Now, I know that some of the controversies have been the cost. And so there's some people that have built business models around charging an awful lot of money. Right now, the SCAT, or the Sideline Concussion Assessment Tool, it's free and it's got the most evidence to support its use. So if I were me and if I were a parent, I would definitely support the use of a SCAT.
Great, thank you. Thank you for this fabulous information, much appreciated. Can you let us know if we can share this recording with others for their learning? I do believe, yes, we are going to be sharing the recording. I believe we are going to have it up on the Alberta Concussion Alliance page, which is through the Sport Medicine Council of Alberta. If anybody else has anything to add to that in terms of the panelists here, they can, but I believe you will have access to the recording. Good evening, Marty. Why does the NHL continue with the isolation protocol for, just finishing the rest, for concussions?
Yeah, that's an important point, because I know that when we talk about the current guidelines, which is for any young athletes, if they have a suspected concussion, they should be removed from play. And yet, if you watch the NHL, you'll see that sometimes they go to the quiet room and then they come out of the tunnel. And I know this past weekend, if you watch NFL football, Tua Tagovailoa from Miami, their quarterback, same thing. And there's a lot of scrutiny under that. Now, at the professional levels, they have a lot of people at their disposal. They have a lot of resources. And so they are able to, I think, provide an informed opinion much quicker. Don't forget that people under the age of 18, their brains are still developing. There's a lot more. Their musculoskeletal system is not yet fully developed. And so there's a lot of variables that differentiate the young athlete from the professional athlete. So I know that sometimes people look at that and say, well, that's not right. It's not consistent. But actually, there's a lot of evidence to support that.
Thank you. Is there a difference between concussion symptoms and post-concussion syndrome? Or would it all just be prolonged concussion symptoms and post-concussion?
Yeah, that's a really great question. So because what we used to call post-concussion syndrome is a constellation of many symptoms like headaches, dizziness, mood issues, all those kind of things, it actually has been taken out of our diagnostic manuals because it's not a helpful differentiator. It actually is too broad. There's just too many symptoms there. So post-concussion syndrome was meant to talk about persisting concussion symptoms, but we don't even use that term anymore. We talk about persistent symptoms. So again, it's differentiating, is this concussion related or non-concussion related? So again, the descriptor here is that persisting symptoms can exist, but there are usually other causes that we want to identify. Hopefully that helped.
Thank you. What are some critical questions to ask an athlete after you think they may have suffered a concussion?
Yeah, so there's some really important protocols. If you go to just go to Google, I shouldn't be saying go to Google, but if you do, and you look up the SCAT, they actually have some what we call Maddox questions. And the Maddox questions have to do with orientation. So that is, can they answer who they are, where they are, what recently happened, what time it is? If they're disoriented at all, and that's an indication that they're not processing information very well. This is to emphasize my previous point, is doing a SCAT. Again, that can be a very handy piece of paper and a little test. That's a good measure if you have a suspected concussion. Because if they can't keep themselves balanced, if they can't do the cognitive activities on the SCAT, then there's a good chance that they're not quite right and you should pull them from a game. So the SCAT is a great resource.
Thank you. What does the research say about girls and concussions? Are there differences from males? Thinking soccer and hockey concussions. Thank you.
Yeah, so in terms of those gender differences, we do see a slightly higher incidence of concussions in females. Some of it has to do with the musculoskeletal system. We have some research that says that girls and young women, when they're having their periods, they may be more susceptible to concussions because of hormone changes. So we do see a higher incidence. The recovery rates are pretty much the same, except there tends to be a higher incidence of mood issues after concussions in females. So again, some things you want to pay attention to.
Thank you. I've heard there is quite a huge difference between onset of concussion symptoms and length of symptoms between men and women, but the research is lacking due to significant more funding for male sports. If this is true, how can this information reach athletes and physicians so women can receive appropriate care?
Yeah, no, and I have two daughters, and so this is really kind of important to me. And I would say that definitely in the last couple of years, especially, we've really seen a lot more research come out, which has been very helpful. Some of the stuff that I can't tell you about right now because it's about to be published, but in a few months from now I could. But we also looked at gender as a factor or predictor of recovery, and so the recovery steps that we talked about today are the same. Right. So regardless of your gender, they are the same. What the sport specific activities are really important there. But really in terms of management, there's not a whole lot of differences. One of the things we are looking at is, are there other unique variables, such as, especially when teenage girls are going through puberty, there tends to be more complications with mood, with headaches, with things like that. And we're still disentangling that. So that's a great point. And certainly I think in the next couple of years, we're going to see a lot more good information come out.
Thank you. I have a couple questions. They're kind of the same, so I'll go ahead and read both of them. But they're asking, can anyone use the SCAT, or does it need to be delivered by a professional? And then the other question is, who is the best person to perform a SCAT? Should it be a physician or a psychologist?
Yeah, and so that's a complicated answer. My belief is that it's better to use a SCAT than not to use it at all. And some of the communities that I work with are in pretty remote areas. And so access to, athletic therapists, to physios, to nurse practitioners, just not that easy. Now, there are standardized instructions. And the important thing is when the test is given, that you follow those instructions. So again, the Alberta Concussion Alliance, the Sports Medicine Council of Alberta, they have some really good resources of what to use. I think it's better, obviously, to go to somebody who has a little bit more experience. So an athletic therapist, a physio, somebody with a medical background. I think they're just more used to giving standardized tests. So I think that's a good idea. But at the end of the day, I'm a big proponent that if you don't have those resources, it's still a good idea to get the SCAT.
Thank you. So we got about 5 minutes, and I do have a couple questions here. And if you do have one last question, please get it in the Q&A so that we can finish on time. So thank you for this info. I was just curious about what dosage you typically recommend for melatonin and omegas for people after concussions.
Yeah, so the studies that we've looked at for melatonin are up to 10 milligrams. Now, again, it's a good idea to talk with your doctor about the dosage. You can get melatonin non-prescription. The studies have either used 5 milligrams or 10 milligrams. We seem to get the better response from 10 milligrams. So again, I'm not a pharmacist, but that's the studies that have been published. For omega-369s, there's usually a daily recommended dosage, right? So you don't need to increase that, because after that, the recommended dosage, it's just not going to do you any more good. There's no more benefit to taking 10 omega-369s or eating a whole salmon versus half a salmon. So it's just going with the recommended guidelines there.
And what is your opinion on CTE as a consequence of repeated concussions?
Oh, we're just going into all the controversial subjects here. This is great. Honestly, my opinion is that the scientific studies have not found conclusive evidence of CTE after concussions. All right. I think people get kind of hung up in this debate that either you're in denial or you're a proponent of this. But really, we don't have great evidence to say that, yes, if you have a concussion, you're more likely to get CTE. There's so many other variables that are involved. A lot of where we've seen this literature come from is professional athletes. And professional athletes, 60% of them, in some of our large scale studies have admitted to substance abuse or prescription substance abuse, mental health. There's lots that going on. And so, I would caution any conclusions about CTE based on concussions.
Thank you. So if someone suffered a concussion but was not diagnosed at the time, is it possible to get diagnosed months or even years down the road? Or since most symptoms are subjective, there is no timeline, ?
Yeah, and that it gets trickier the farther you're out from a concussion, that's for sure, because there's lots of other intervening variables. Again, that would take, I think, a very comprehensive assessment to really tease out these other variables. And I think psychologists and physical medicine and rehab specialists are pretty good at that. But again, it gets really, really tough to diagnose somebody retrospectively. Now, obviously, imaging, if there's positive findings on imaging, that helps a lot. But as I said before, most people are not going to have positive imaging findings after concussion.
Right. Okay, it looks like we might have two, but one question for sure left here. How far are we away from a diagnostic tool to diagnose a concussion medically? So example, brainwave measures.
We're working on that right now, right as we speak. So Kathy Beltman and I are part of a study. We're looking at biomarkers. So saliva, blood tests, imaging studies, that's a really big topic. So of course, if we can provide some answers on that. So right now there hasn't been any large scale studies. We're part of that. So hold on tight and we'll probably be able to tell you in a year or two.
Okay, I think we have time for one last question before we wrap up. If performing a baseline concussion test and the individual in question is very symptomatic, would you recommend getting them cleared by a physician or psychologist, or accept the baseline as very symptomatic?
Yeah, important point. We've actually found in the NHL and the CFL that there's some times that players are just too symptomatic. They can't even do the activities without feeling, really bad or even throwing up. And if that's the case, then we really want to, repeat the test a few days later. It is a good idea to do it sooner than later, within 24 to 48 hours. But we've had a few players that are not feeling good, and in that case, I think it's a really reasonable idea to delay that. Having said that, if somebody is 3 days later and they're still struggling, there's probably a good reason for them to need medical attention. So that's the direction that I would go.
We had a quick comment in the chat noting that you had mentioned or it appeared on one of your slides, the CAT Online tool. Did you have any comments or anything to say about CAT Online?
Yeah, I mean, you want a tool that's research based. And the CAT has been a very well-designed tool. The people involved in it, Shalina Baboul and Ian Pike, won awards for that. They've done some fantastic work. I'm a fan. It's not the only thing out there, but I also think it's been a very, very helpful resource. So yeah, I have no hesitations in suggesting it's a good way to go.
Yes, thank you. And for those who don't know, it's concussion awareness training tool is what the CAT is. All right, well, we've reached 8 o'clock. We're gonna wrap up questions, and I'm actually going to pass it over to Lindsay Terrahorst, the Executive Director of the Sport Medicine Council and our co-chair for the Alberta Concussion Alliance.
Hello, everyone. I first want to say a big thank you to our wonderful speaker, Marty. It was a fantastic presentation, and it's always a pleasure to continue to learn about updated concussion information. Second, I would like to thank the Injury Prevention Center for hosting this webinar and making this event possible. Third, I would like to thank all members of the Alberta Concussion Alliance for additionally making this webinar possible and continuing to provide strategic direction in our communities about concussion. And last but not least, I would like to thank everyone who took the time out of their day to attend this webinar. It's amazing to see so many individuals who are eager to help increase concussion awareness in Alberta. These efforts will help improve overall concussion knowledge that can in turn lead to changes in attitude and behaviors around concussion as we facilitate more open conversations. And as a reminder, Wednesday, September 28th is the second annual Alberta Concussion Awareness Day. So if you're looking to continue to expand your knowledge of concussion, I invite you to go look at the Sport Medicine Council of Alberta website. It has a vast resource guide of credible evidence-based concussion resources. There is also an education tab there for more concussion education with online courses and webinars you can take. And as we're talking about resources and education, if you are interested in attending an additional concussion event on September 28th, the Sport Injury Prevention Research Center at the University of Calgary is hosting a research and community engagement symposium on injury prevention and concussion. There's still time to register if you'd like to attend virtually, and we can provide you with that link to register. In closing, I want to thank you all again for attending the webinar. We will be putting out a survey link in the chat as well as sending it out to participants. And we would love to hear your overall feedback on the webinar and welcome any suggestions for improvements. So thank you again, and I hope everyone has a great evening.